citizens, an organization of about 4,000 members throughout the state. I am directing this question to Tammy Baldwin. Currently, over 1/3 of the elderly in the United States, the disabled on Medicare, and all approximately 38 million uninsured U.S. citizens have no insurance covering the cost of prescription drugs. Drug companies are among the most profitable in the world, averaging nearly 20% profit annually. Almost every other industrialized nation in the world uses a variety of means to control drug costs and make prescription drugs available to those who need them. Canada, for example, negotiates the price of drugs with drug companies, making the same drug as offered in the U.S. between 40 to 75% more affordable. My question is, would you support legislation such as T-Rex that harnesses the bulk paying power of the state to negotiate lower prescription drug prices for the elderly, disabled, and uninsured?
But let me use my remaining 1 minute and 55 seconds to say that this is an issue that is close to, I think, everybody's heart. Until my grandmother passed away last year, I spent the last 4 years of her life as her primary caregiver when she was between the ages of 90 and 94. I saw firsthand the experiences that she had trying to maintain her health, trying to deal with the bureaucracy of Medicare and Medigap, and the fact that prescription drugs were not covered under Medicare. It is also the most frequent thing I hear about as a member of Congress, whether I'm doing my grocery shopping or walking down the street or at the baggage claim at the airport when I come home every weekend. Somebody will pull me aside, often open up their purse, show me the pill jar, and talk about the struggles and the choices that they are making in their own lives because we haven't done the right thing and covered prescription drugs. Two things need to happen at the federal level. First is the cost control and doing something about this unconscionable price shifting that's going on. We know about the prices in Canada versus the prices in the US, but the same thing happens, as the good pharmacist was just mentioning, if you're insured versus uninsured. A woman who has breast cancer, who has to take tamoxifen for the next 5 years, if she has insurance, her insurance company's getting a good rate. If she doesn't, she's paying top dollar, and that is unfair. The second thing we need to do is have a prescription drug benefit fully covered in Medicare, just like everything else is in the Medicare program, hospital visits and doctor coverage. That is the right thing to do. If we were inventing Medicare today, we would do that. We have to add it now.
We're generally minimal and under 1%. Congressman Tammy Baldwin, would you support legislation such as Senate Bill 543 and House Bill 3066 calling for a comprehensive parity in health insurance sold in the United States for mental health and substance abuse?
Well, thank you, Brad, for that question. And I am proud to tell you that I am a co-author of that bill from the moment it was first introduced, and a predecessor version that was introduced earlier in the Congress. And I just want to take a moment to recognize the work of NAMI and AMI. For those of you who don't know, this organization was founded in Wisconsin. And it was citizen activists, particularly parents and family members of people who suffered mental illness, who have done an enormously successful job of educating the American public and educating policymakers. And one of the most convincing arguments that you heard embodied in that question is that while there are incremental increases that people might experience in premiums, and I know that's tough at a time like today, the cost savings are dramatic. The cost savings in terms of productivity, of preventing suicide, of preventing incarceration, of preventing sick leave at work. These are critical issues that contribute to our economy, and it is absolutely the right thing to do. I also want to tell you that I'm hopeful on this issue. The bill that you mentioned in the House is bipartisan. It is something that many members have expressed a lot of interest in. I'm in a working group on mental health issues, trying to bring this issue to a more, to be embraced in a more bipartisan way. And we've been getting little hints from the White House that they might even be supportive of such an initiative. I'm hoping this will be the year where we actually take a step forward at the federal level on mental health parity. And thank you for your advocacy.
Times, and the goal of securing health care coverage for each U.S. resident. If so, would you specifically go about securing health care coverage?
This is my favorite question. If there's one thing that brought me to public service and an aspiration of running for office, it was because of the possibility of making a difference on this very issue. I believe that we had a great vision at the founding of this nation when we made a commitment to education for every child, because we understood that a public education for every child was going to have great impact for our economy, for our democracy, and for the children we educated. I think we will sort of fulfill the promise in this country if we make that same commitment to the health of every individual. That the good results that will produce will help the individual, strengthen the family, strengthen the community, strengthen our economy, and strengthen our democracy. We had a debate about a decade ago about a plan to bring health care to every American. Unfortunately, that failed. I don't think one walks away from that and says, oops, we couldn't do it. I think you return again and again and again until we get the job done. If I were CEO, I would propose a single-payer solution. It addresses all of the issues that Dan raised about the waste, the bureaucracy, the fact that only 75 cents of every dollar goes to health care, and we're wasting a lot of the rest. But I have introduced legislation just recently and reintroduced it from the session before, along with Congressman Obey and Senator Wellstone, to allow each state to adopt a universal health care program and have it controlled at the local level with lots of input. I think that's the way to go. We need to get this job done and realize our potential in this country.
200 people in our county with Alzheimer's disease and approximately 20,000 caregivers. I will be voicing the audience questions. Audience question 1 goes to Tammy Baldwin. Have you accepted any money from pharmaceutical companies, and if so, if you do get any, will you return it?
I am not aware of any political action committee a donation that has been made to my campaign from pharmaceutical companies. I didn't bring all the documents with me, but I will double check and make sure that that statement is accurate. Having said that, just to clarify for people, because these rules are very important, especially in this day and age, companies cannot give checks to candidates, I think at any level, in the state of Wisconsin or federal level. Corporate gifts or donations are not permitted under law. They have political action committees, and they do try to influence the outcome of elections that way. And as I stated at the beginning, I am not aware of any political action committee contributions that I've taken from any pharmaceutical company.
Back to my high school days in the gym, but I was outside skipping out. Anyway, first of all, let me correct a couple of things that I've been disturbed by. First of all, there's this myth that Republicans are these rich folk who only care about the rich and not the regular working people. Let me let you know that I'm not a rich person, and I care about people, everybody, including the elderly and those who aren't insured, which are a large portion of my family members. I'd like you to know. That being said, let me also address a couple other things. First of all, the idea that pharmaceutical companies are the most profitable companies in the country. That is not exactly true. They are only slightly profitable than some other companies. The problem with that is an accounting anomaly whereby research and development prices and costs are considered an ongoing cost or a present cost. Therefore, over the long, it doesn't get stretched out over the long run. So because it doesn't get stretched out, it looks as if they're making a lot more profit. Second thing is, pharmaceutical companies have the highest research and development of any corporation, any business anywhere. You're talking 10 to 15 years to develop a drug. You're talking 1 out of every 5,000 drugs actually make it to the market, and only 3 out of 10 of those drugs actually make money. So in essence, 70% of the profit of the company is made by those 3 drugs. Now the question is, if we want a system whereby we shackle pharmaceutical companies so they can't make a profit, then we doom ourselves to a system that will fall apart. Because pharmaceutical companies are public companies. They have to make a profit. They don't have a profit, people don't invest in the company. They don't invest, the company goes out of business. Therefore, you have no drugs, you have skyrocketing drug prices. As to Canada, Canada's system is one of the worst. If you want a Canadian system where you have waiting lines and you're restricted, there's 600 drugs for elderly people in this country that Canadian elderly don't have. I prefer having those 600 plus drugs available to my grandmother, my mother, my father, as opposed to not having anything at all. So I would not support the legislation that would destroy our healthcare system.
And my question to each of you gentlemen is that would you support legislation such as Senate Bill 543 or House Bill 4066 calling for comprehensive parity in health insurance sold in the United States for mental health and substance abuse? And either one, please. Thank you.
Thank you again. Let me again reiterate my concern about government involvement in regulating the industry. I don't think that there's an example around where that hasn't worked to our detriment. As far as the bill requiring companies to have mental health parity, I would also be opposed to that. Now, not because I'm heartless, not because I'm just uncaring. Again, I can relate to the issues well. We have a number of mental health issues in our family, in both sides, my wife and my family. And individually, we are involved with helping out and have on occasion taken care of. My mother still takes care of, well, up until this past year. My uncle, great uncle, who died recently. So I'm not without concern. I'm not unaware of the issues. I am, however, aware of the fact that there are a number of drugs, prescription drugs, that are already covered, mental health drugs that are already covered. My nephew's on Ritalin and a couple other psychotropic drugs. They are covered by his health insurance. Now, there are some things that are not. But requiring an insurance company to cover those, I would be opposed to that. My involvement in prison ministry and counseling over the last 20 some odd years has also said that there's an alternative to drug treatment and mental health, and there are very few mental health issues where therapy isn't just as effective as drugs or more effective as drugs. And until we get a definitive answer about whether drugs are the answer or not, I think we should forego any legislation that would encumber that process. So it's been my experience that more therapy is more effective than drug treatment. There's no proven drugs that are effective in mental health issues. It's not the magic pill. The bill proposed in how much time? Okay, I'll wrap up. I'm sorry. Anyway, my answer essentially is no. I would not support the bill in its present form.
In these tough economic times, to the goal of securing health care coverage for every U.S. resident? If so, how would you specifically go about securing health care coverage for all residents?
Could you read that statement? First thing you read,
Wisconsin and the nation are in the midst of a serious health care crisis. Skyrocketing health insurance premiums are causing employers to cut back on health care costs and pass the costs on to the employees. There are horror stories of self-employed persons living without health care, companies forcing early retirement into unhealthy employees, people stuck in mismatched jobs or mismatched marriages simply to maintain access to health care. In the last years, many who may have been recently laid off during this recession cannot afford to cover their health insurance because of limited unemployment income. However, contrary to the public belief, or popular belief, we can achieve universal health care without increasing taxes if we are willing to redirect health care dollars away from the profit of the administration and actually apply them to healthcare. Healthcare administration is responsible for 24% of the healthcare costs. Universal costs have also added on benefits of controlling the eventual reducing healthcare costs by providing preventative service rather than emergent service. It also eliminates the need for cost shifting from the uninsured to the insured, which leads us to unpredictable premium increases.
Same points, but I'll kind of add to that. If we direct profits or dollars from profit, from the profit and also from administrative costs, and pass those on to, I'll agree with Phil, we pass that cost on when the profit is reduced, then of course we have no health care coverage at all, which is again my problem with the whole idea. It would kill the healthcare industry, and in the long run, all of us, including our seniors, will be left high and dry with no insurance coverage at all. And we will go from a system where we have, back to a system rather, a class system, where the rich had health care and the poor played the life lottery. If you make it, you make it. If you don't, you don't. I don't think that's compassionate. I don't think it's sensible or wise to report such a thing. Inflation, he mentioned something about inflation as well. Inflation is a reality. If I want higher wages, then my employer has to make a profit. Cost of the product and service goes up to the consumer pays more, i.e. equals inflation. I think it's a bit, it's a fallacy to somehow believe that we can have everybody covered with every single thing available and then pay less as well, which is what these questions do. The first two questions seem to demand something that's going to cost more money. The third one talks about the rising cost. You cannot have more with a lower cost. It does not make sense in anybody's mind, in any world. So we cannot have it. It must be realistic. And being realistic is this. I think that every single person who has health care coverage and has prescription drug coverage should have the same choice that Tammy Baldwin has, and every federal employee. You're able to pick any health care plan you want. Those things in the health plan you don't want, you shouldn't have to pay for, shouldn't have to have. So what we need to do is eliminate the government mandate on what coverages you have to have. Second is, we need to give every single person ownership of their health care account, whereby it's not connected to an employer, so once you lose your job, you lose your health care coverage. That doesn't make sense. My health care coverage, that's it? Okay, I thought I had extra time today.
Have either of you accepted any money from pharmaceutical companies? And if you do get any money from a pharmaceutical company, will you return it?
No, I haven't accepted any, but if you can arrange a pharmaceutical company to send a PAC check, I would be more than happy to accept it. I'm a representative of all the people, including pharmaceutical employees who volunteer to put money into a fund to help people get elected. I'm not opposed to representing special interest groups, so-called special interest group. When the average person doesn't have an opportunity to express themselves, they need somebody there to express themselves. For instance, AARP. I don't think any of you, anybody else would deny they'd accept money from AARP's PAC or any other PAC that agrees with you politically. So it's ridiculous to somehow demonize somebody because they collect money from a pharmaceutical company. That pharmaceutical PAC is indeed individuals who have a certain interest and a certain voice they want heard. And if they want you in Congress because you represent their views, I think they should be allowed to give you money, just as AARP and any other organization as well. So yes, and if you can arrange that, I'd be glad to accept it.
The Supreme Court granted personhood to corporations. At this point, corporations have less accountability and they have more power than we do as voters. Corporations are not mentioned in the Constitution at all. What steps would you take to correct this?
The question, if I assume that you're correct, I would say you're wrong. You're not correct. Corporations are not persons under the Constitution. I would agree with that part. However, do corporations have more power than people do? Absolutely not. Corporations, if you believe that, then of course we might want to believe the fact that Elvis is still alive as well. But believing and saying it doesn't make it true. The fact of the matter is, people have voting rights, and they vote. More of those people vote, and corporations don't vote. People vote. Now, if people don't vote, And corporations fund a candidate, and the people vote for that candidate based on what they believe that candidate stands for. That's not the corporations, those are the voters. Now, the solution to it, if you believe the corporations have a lot of power, the solution is organize and make sure the votes get out. Because if in my last month, as far as I know, when they count votes, they count individual votes. They don't count the corporation that voted for a person.
But not in Florida.
Sir, not in Florida, not anywhere. It happens everywhere. It's the same everywhere.
No, it isn't.
No. Again, like I said, you can believe it if you like. Saying it doesn't make it true.
But it is true.
It is not true.
Have you looked at the laws in Florida?
Sir, it is not true.
Look at the history of the Supreme Court decisions.
As I said, you can say it and say as long as you
Look
like. It
at the
doesn't make it true.
history.
Look at it.
All right. I can say I'm a poached egg, but it doesn't make me a poached egg. All right?
I have a question.
Yes, ma'am.
I was just wanting both of you to indicate that you felt that universal health care would be a cost that we couldn't afford, and that we were already pinching pennies now. But I've read like 3 different studies from the Lewin Group from Maryland, California, and Vermont, all 3 of which said that when universal health care is applied on a single payer basis, is actually the most efficient and economical, and the states that moves to that model will save money on their health care costs within 5 years. Have you read those studies?
I want to ask, can you come to the microphone?
Group studies from California, Maryland, and Vermont.
And we'll take 1 minute with the time. Okay. You asked if they had read the Lewin Group studies on whether healthcare can be universally affordable. Is that correct?
Universal health care coverage in those states.
There were studies that found that single payer, in fact, did not cost more than what we have now. In fact, it would be cost neutral within 5 years and then start costing less. I'm just wondering whether they're familiar with those studies.
I read the synopsis of the study. My skepticism lies in the fact that those systems haven't been around long enough to report whether or not it's good or bad. Secondly, from my perspective, 1 and 1 always equals 2 in our system of math. You can't have 3 and 2 equaling 1. That's essentially what those New England states who went to universal health care say. You cannot. It's impossible. It doesn't happen. You can, however, fix numbers and change figures around where it looks as if this is actually costing less. Because by the study's own claim is that up front, the first few years, it costs more. And the theory is that after a certain period of time, the cost will go down. Now, in my experience, and maybe yours is different, anytime a government official tells me the cost is small up front, it'll go down later, I've never seen one program where that takes place. So those 2 things alone would convince me that it still doesn't work. It's inconclusive. And again, facts would say different.